So let's get into it. Introduction. Geriatrics is the assessment and treatment of disease in a person 65 years of age or older. Geriatric patients present as a special challenge for healthcare providers. Injuries and illnesses are affected by chronic conditions, the use of multiple medications, and the process of aging. General consideration. It is most important to understand and appreciate how the life of an older person might differ from yours. It takes time and patience to interact with an older person. Treat the patient with respect. Make every attempt to avoid ageism. So not all older people have dementia. Not all older people are hard of hearing. Not all older people are sedentary or immobile. Your ability to communicate with these patients is something that is going to be extremely important. You have to be able to communicate well. So good communication is essential to your geriatric population. So effective verbal communication skills are essential. Communication techniques should include, you need to speak respectfully, identify yourself, be aware of how you present yourself, look directly at the patient at eye level, speak slowly and distinctly. Have one person talk to the patient and ask only one question at a time. Do not assume that all older patients are hard of hearing. Give the patient time to respond, and if they are responding, listen to what the patient is telling you. Explain what you will be doing for the patient and how you intend to do it. The geriatric population is predisposed to a host of problems not seen in youth. Hip fractures are very common, especially in the female geriatric patients, more likely to occur when bones are weakened by osteoporosis or infection. Sedentary behavior can lead to pneumonia and blood clots. So pneumonia is very common in the geriatric population, and they get pneumonia without a fever. So they have atypical presentation. They can get pneumonia and they don't have any fever. Now let's look at some changes in the body as a result of aging. The aging process is accompanied by changes in physiologic function. All tissues in the body undergo aging. Decrease in functional capacity of various organ systems is normal, but can affect the way a patient responds to illness. Normal changes should not be mistaken for signs of illness. Genuine symptoms should not be attributed to just getting old. So let's look at the respiratory system now. Changes in the respiratory system. Age-related changes can predispose an older adult to respiratory illness. So the airway muscles become very weak over time as we age. The alveoli in the lung tissue becomes enlarged and they lose their elasticity. And the elasticity is important to the exchange of oxygen and carbon dioxide. So that's not good. The body's chemoreceptors slow with age, so they don't respond as quickly as they normally do. Pneumonia, inflammation or infection of the lung from bacterial, viral, or fungal causes. It's a leading cause of death from infection in Americans older than 65 years. Very common in Jamaica as well. Aging causes some immune suppression and increases the risk of contracting infections like pneumonia. There is increased mucus production Pulmonary secretions and infection all interfere with the ability of the alveoli to oxygenate the blood. Where respiratory protection, when you are assessing a patient with potentially infectious respiratory disease. Pulmonary embolism. So it's the same medical emergencies, right? Same medical emergencies, but there are some subtle differences, and what you really need to pay attention to is what would the atypical presentation be. And for that to stick, you have to know what the typical presentation is already. So pulmonary embolism, condition that causes a sudden blockage of an artery by a venous clot. A DVT is a common cause. A patient will present with shortness of breath and sometimes chest pain. Pulmonary embolism risk factors, patients in nursing homes. And in my experience as a responder, working overseas and working in Jamaica, some of the worst, I would say, the most difficult calls I've had in terms of geriatric patients have been from nursing homes. These patients are never in good condition, based on my memory, right? They're always in terrible conditions in the nursing homes, and nobody is able to give you clear information about the patient. Anyway, so pulmonary embolism risk factors: living in a nursing home, recent surgery, history of blood clots or heart failure, presence of a pacemaker or central venous catheter, obesity or sedentary behavior, recent long distance travel, trauma, cancer, or paralyzed extremities. Pulmonary embolism will present with tachycardia. They'll have sudden onset of dyspnea, very common. They'll have shoulder, back, or chest pain. They will cough, syncope in patients whom the clot is larger, anxiety. Apprehension, low-grade fever, hemoptysis, leg pain, redness, unilateral pedal edema, fatigue, and if it's a saddle embolus, they can have cardiac arrest, and that's worst case scenario. So that's the worst thing that can happen to a patient with a PE. And you will see pulseless electrical activity if you put these patients on a cardiac monitor or do a 12-lead ECG. Changes in the cardiovascular system. The heart hypertrophies, so it gets larger with age. And I have seen patients where their heart is so large that you can actually see their apex beat. So I've seen patients where I can see the apex beat. I don't need to put the diaphragm of my stethoscope to listen to it. I can actually see it. Cardiac output declines. Arteriosclerosis contribute to systolic hypertension. Many people tend to limit physical activity and exercise as they grow older. And it's very important to keep your body active as you get older, because as you get older, the metabolism slows down. You don't lose weight as quickly as before. So it's important to stay active. Geriatric patients are at risk for atherosclerosis, the accumulation of fat and cholesterol in the arteries. Major complications include myocardial infarction and stroke. Affects more than 60% of people older than 65 years. Older people are at increased risk for formation of aneurysm. And aneurysm can form in the brain, it can form in the chest, and it can form in the abdominal aorta. So the aorta, The portion of the aorta in the chest can have an aneurysm, can form in the head, cerebral blood vessels, and it can form in the abdominal aorta. So abnormal blood-filled dilation of the blood vessel wall, severe blood loss can occur, blood vessels and heart valves become stiff and degenerate, heart rate becomes too fast, too slow, or too erratic. Another vessel-related problem is venous stasis, so the blood doesn't flow very well in the venous system, and this puts the patient at risk for developing clots. Loss of proper function of the veins in the legs that carry blood back to the heart causes blood clots. Deep vein thrombosis can lead to pulmonary embolism. People usually exhibit edema of the legs and ankles. Heart attack. Now, with the geriatric population, they have what is called silent heart attacks. They don't complain of pain. Rarely they complain of pain. And it's going to be common to the female geriatric population and people with diabetes, geriatric patients with diabetes. The classic symptom of a heart attack are often not present in geriatric patients. They get silent heart attacks, and it's common in women and people with diabetes. Any of the following symptoms may be a manifestation of acute cardiac disease. All they can present with is difficulty breathing, or they complain of acid indigestion and abdominal pain, loss of bladder or bowel control, nausea and vomiting, weakness, dizziness, lightheadedness, syncope is very common, fatigue or confusion. They can have issues with their circulation or complain of issues with their circulation. They can be sweating profusely. They can have changes in the skin color, mottled skin, pale, cyanotic. They can have issues with their respiratory system, where they have abnormal or diminished lung sounds. They can have edema present. Oops. The signs and symptoms will differ depending on whether the right or left side of the heart is not functioning correctly. And by now, we know what to look for if it is left side or right side heart failure. That is my expectation. Right-sided heart failure occurs when the fluid backs up in the body, and this will lead to jugular venous or jugular vein distension, fluid in the abdominal region, peripheral edema, and an enlarged liver. Right-sided heart failure is often caused by left-sided heart failure. So it is common to see signs of both. With left-sided heart failure, fluid backs up into the lungs, causes a condition called pulmonary edema and shortness of breath. The patient will have severe shortness of breath and hypoxia with crackles in the lungs. And this is your patient that will benefit from CPAP if it is not contraindicated. Paroxysmal nocturnal dyspnea. This is the sudden onset of difficulty breathing at night. So paroxysmal nocturnal dyspnea, characterized by a sudden attack of respiratory distress that wakes the person when he or she is reclining. Caused by fluid accumulation in the lungs, patient reports coughing, feeling suffocated, and cold sweats. You will notice tachycardia. If you suspect heart failure, ask, do you sleep sitting up or do you sleep using pillows? If yes, How many pillows do you require to sleep at night? Very important. Stroke, leading cause of death in older people, preventable risk factors, smoking, hypertension, diabetes, atrial fibrillation, obesity, and sedentary lifestyle. Uncontrollable factors, age, race, and gender. Signs and symptoms: acute altered level of consciousness, numbness, weakness, or paralysis on one side of the body, slurred speech, difficulty speaking, issues with your vision, headache, dizziness, incontinence, seizure. Hemorrhagic strokes are less common and more likely to be fatal. A broken blood vessel causes bleeding into the brain. Ischemic stroke occurs when a blood clot blocks the flow of blood to a portion of the brain. The treatment goal is to salvage as much of the surrounding brain tissue as possible, so time is important. If the symptoms occurred within the past few hours, the patient will be a candidate for stroke center therapy. Transient ischemic attack can present with the same signs and symptoms as a stroke, but within 24 hours, they disappear. Changes in the nervous system. Changing in thinking speed, memory, and postural stability are the most common findings. The brain decreases in weight and volume, so there is more space inside the skull for the brain to shift around. There is a 5 to 50% loss of neurons in older people. The performance of most of these sense organs declines with increasing age. Vision, visual acuity, depth perception, and ability to accommodate light change with age. Cataract interfere with vision, so that's a lens that forms over the eye, right? A film that forms over the lens of the eye can affect their ability to see. Decreased tear production leads to drier eyes. Inability to differentiate colors can occur. Decreased night vision, inability to see up close, presbyopia. Other diseases, glaucoma, which is an increase in pressure on the optic nerve in the eye that can occur. They can have macular degeneration. They can have retinal detachment. Remember that the retina is a link between the eye and the rest of the brain. So if retinal detachment occurs, patient won't be able to see. Hearing problems cause changes in inner ear, making hearing high frequency sounds difficult. Problems with balance make falls more likely. Presbycusis is a gradual hearing loss. Heredity and long-term exposure to loud noises are the main factors. Taste, decrease in the number of taste buds. Food don't taste the same to them, so they don't eat a lot. That can lead to malnutrition. And if the body is malnourished, the immune system breaks down. If the immune system breaks down, then the patient is more prone to getting ill or sick. Negative result might be lessened interest in eating, which can lead to weight loss, malnutrition, complaints of fatigue. Touch. Decreased sense of touch and pain perception from the loss of the end nerve fibers. An older person may be injured and not know it. There is decreased sensation of hot and cold. Now, dementia. which is irreversible, is the slow onset of progressive disorientation, shortened attention span, and loss of cognitive function. It is chronic, it is generally irreversible, and condition that can cause a progressive loss of cognitive abilities, psychomotor skills, and social skills. Dementia is the result of many neurologic diseases, and it may be caused by Alzheimer's disease, Parkinson's disease, cerebral vascular accident, and genetic factors. On assessment, patients may have short and long-term memory loss. They have decreased attention span. They may be unable to carry out everyday routines. Their ability to communicate deteriorate over time. They start to have changes in their moods and emotions. Their judgment is impaired, and they're unable to vocalize pain. Delirium. Delirium is a sudden change in mental status, consciousness, or cognitive processes, which can be reversed if we can identify what is causing it. So it's marked by the inability to focus, think logical, and maintain attention. It affects 15 to 50% of hospitalized people aged 70 years or older. Patient will have acute anxiety. It's a possibility that they will present with that. Generally, it is generally the result of reversible physical ailments such as tumor, fever, or metabolic causes. Right? So once we can identify the cause and remove it, then they will recover. In the history, look for withdrawal from alcohol or sedatives, medical conditions, psychiatric disorders such as depression, malnutrition, or vitamin deficiencies, environmental emergencies. Assess and manage the patient for hypoxia, hypovolemia, hypoglycemia, hypothermia. You may see changes in circulation, breath sounds, motor function, and pupillary response. Syncope. All right, so we will stop at